Wow. Good morning, everybody. We are delighted to have you joining us today for actually a milestone. This is our 10th podcast, and I feel like each and every one gets even better. And today is no exception because I get the absolute pleasure of chatting today with a dear friend of mine. In fact, a person that I would consider one of the best leaders I've ever had the opportunity to work with. And so, Snehal, thank you so very much for your graciousness to participate with us in this podcast. And we are looking forward to a super conversation today.
Thank you so much to the both of you. It's great to see you, Seth and Shane. Um, you know, it's an honor to be here, and I appreciate you guys inviting me and sharing a little bit my stories and how I can give back. So thank you.
That is awesome. Well, thank you for being here. And just for the audience who's listening, a little bit, and Snehal, feel free to fill in the blanks here.
Yeah.
But we were just in a time capsule a few minutes ago before the show started. And I think we go back 20 years when we were all much younger, right? With no gray hair. And we met when you were at Genentech in the Bay Area. And what role were you in when we met for the first time?
Yeah, Shane, I was a supervisor on the manufacturing floor.
Wow.
And I was introduced to both you and Seth it was a little bit of a workshop.
Uh-huh.
And you introduced me to process-based leadership. And I have to say, 20 years after, I still use it every day.
Oh my goodness. Well, that's a nice compliment. And you've certainly come a long way since a supervisor at Genentech. I mean, just hitting the highlights of your career, right? So you were there probably what, 15 years or so? How long were you at Genentech?
Yeah, 18 years at
18 years.
Genentech, a
And
variety of
then
different roles. Yep.
and then moved up to Juno as the site leader, correct?
Yes, yep.
And you were
And
there how long?
I was there for about 4 years through the acquisitions all the way through BMS, and then became the global head of cell therapy manufacturing and built a number of sites and such. And then I joined Sana about 2.5 years ago, and eventually as their head of supply chain and manufacturing, but then became the chief technical officer for all of technical operations here at Sana.
Wow, that is fantastic. And tell us just real quickly what Sana is focused on.
Yeah, Sana is all about repairing and replacing genes and really going after autoimmune diseases as well as type 1 diabetes in the allogeneic cell therapy and gene therapy space. We've got some products in clinical trials, and then we're working on some assets that are in preclinical. My role is really to take what research has developed and then translating it into manufacturing supply and working with my team to get that done.
Wow, that is fantastic. Well, I know, Seth, you've got a couple of questions to kick us off for Snehal, so have at it.
Yeah, thanks again, Snehal, to be here. And before that, we went live. I know we were catching up, talking about our families and our kids and so forth. But, as you reflect back on your younger days, were you intentional about getting in the life science space, or did you just kind of fall into it and said, this is what I want to do?
Yeah, it's a great question, Seth. So originally when I was going to college, I started at a community college because I didn't know what I wanted to do. But I knew I had to get into college and do some general ed. So I started there, and I thought computer science was the way. I quickly found out that wasn't the way for me. Then I said, okay, I want to become an eye doctor. When you're, from an immigrant family, especially in the Indian family, you're either a doctor or a lawyer. Anything less is like you're just not, you're unsuccessful. You don't be around. So I was going to become an eye doctor, and then got into the Illinois College of Optometry. I saw the tuition. I said, this is a bit steep right now. And, I have a brother and sister who are far younger. I don't have the heart to tell my parents I need this money to go to school. So I said, I'm going to try this Genentech thing out. They had come to our school, and they said, we need bioprocess technicians. This is on the shop floor, on the bench level, doing research and development and manufacturing. And they had weekend shifts and night shifts. And I'm like, oh, I can go there, make a little money, and then go back to school. Mm-hmm. Well, I joined, and because of just great leaders and mentors at Genentech, they saw something in me that I had no idea. And they invested in me in many ways. And one of the first inflection points that really told me like I'm in the right place was I had the opportunity to go to a seminar by Stephen Covey, the 7 Habits of Highly Effective Leaders. And I think that was the first inflection point in my career that I'm like, I want to be a leader and I really want to help in many ways. And then it just took off. And now 24 years into it, I'm here.
Wow, that is awesome. I love, because I had a similar experience with Stephen Covey and that whole one of his themes of, sharpening the saw, right? And I know that's something that you firmly believe in because development doesn't stop. Even though you're the chief technical officer today, you're still learning and growing and developing, but even more so, developing your team beneath you. Were there any, like, as you think about the last 24 years, were there any critical like inflection points or milestones where you either had a mentor or you were a mentor that was memorable and remarkable for you?
Yeah, earlier on in my career, I've been blessed with just incredible mentors from all walks of life and people who really were invested in me. Shane, you were one of them, right? I mean, you really introduced me to what process-based leadership was all about and just, how to really change and move organizations forward and focus on the right things. I have mentors today that I continue to meet with that, help me, in really deciding, okay, here's a challenge that I have. How can we help through it? Pat Yang being one of them is one of the reasons why I'm here in Seattle and now at Sana. And, he still continues to be a mentor. Now my job is really to pay it forward. So I spend a lot of time mentoring now. And whether it's within the company or outside the company and many, many colleagues across that I've interacted with throughout my career, I do everything I can to give back. And I think you guys see this too, in that reverse mentoring happens as well. So me staying connected to what's going on, also, I learned a lot from them. Like, here are the ways to communicate, the different generations at the workplace. And I'm learning a lot every day as well. If I can give back and help them in their careers, they're also helping me.
Yeah, that's awesome.
Have you seen, over time as you've developed your leadership skill set and your leadership traits and qualities, have you seen with the younger generation, you have to adapt and kind of change your approach versus someone that's not so young?
Yeah, look, we're constantly adapting, right? With the multi-generations in the workplace, you've got to be that leader that's like the chameleon to adapt to what are their needs, right? So, it's not one way, it's really understanding what are they going through? What are the things that's important to them? And then how do you adapt your leadership style to really maximize their full potential? And, it takes a lot of compromise too. Humility goes a long way, right? And connecting with folks, it's really ensuring that you play that empathy and understanding from their point of view, like what are they faced with, right? And it's different. It's different than when I was 20 years ago when I came out and what, I am blessed with great kids that remind me every day things are different, Dad. So it's great. It helps.
Yeah, we always have our family to kind of keep us grounded, right?
Yes.
I know, speak at a lot of biotech, gene therapy, cell therapy conferences. What do you see right now in the industry, Snehal? Because that is such, the work you guys are doing in that field, it is changing. It's changing the face of medicine. It's changing the face of healthcare. It's changing the face of treatment. Like, what do you see as not only what's happening from a positive standpoint, but what are still some of the hurdles your industry's facing right now?
Yeah, the evolution of biotech 20 years ago and where it is today, it's incredible. Just, with cell and gene therapy, there's just so many different applications out there. So that's the beauty, right? You're able to innovate. Now, the flip side of that, in the industry right now, it's a tough time, just with There's so much prioritization going on, and it's investment communities and such. The hurdles are a lot greater on a clinical development side. So there's challenges there, and we have to constantly kind of adapt, pivot, and flex, and be able to kind of look at the competitive intelligence that's across and determine, okay, let's move in this direction because this is what's going to provide value to patients. Different types of therapies out there, whether they're bispecific, cell therapy, gene therapy. And many companies are going after it, and the bigger companies are doing well because they have a portfolio of products.
Mm-hmm.
Smaller companies are having a difficult time. There's challenges there, and the FDA is doing their part, and regulatory agencies, but with these novel therapies, they don't know how to quite okay, we're going to treat you like this, but it may not be the same. So it's a constant dialogue we're trying to have with regulatory agencies as well.
Yeah, because you guys are really pushing the envelope in terms of therapies, right? Which they may not even be able to wrap their head around yet.
No, exactly. So it does require good collaboration and, just having a conversation with them. And we've had multiple conversations with the FDA just to showcase what are some of the therapies we have, the innovative therapies for unmet medical needs. And they're willing to work with us and willing to really help us be able to get this product to patient.
That's fantastic.
How does data play a role in what you're doing with the therapies and development? Do you have metrics that you're looking at on a daily, weekly, monthly basis, Snehal, to measure the progress and see if you're moving it forward?
Yeah, we have to have the right measures in place that then enact the right actions. And I will say, in a small company, especially preclinical, where you got a lot of research and development, they look at me like, what do you mean metrics? What are you talking about? We don't need that, I'm like, look, it's data. It's data that tells you okay, let's double down or let's focus on this area. So, we do, one of the first things that I did was introduce a scorecard and really focus on certain actions that help us achieve our corporate objectives and what are the measures in place. But it is a constant, just helping to educate folks that it's okay to be red. It just means that we need to focus here and put a little bit of attention there. It's not a bad thing. It's just let's put some effort, a little closer effort here. But it takes a while to get folks to get comfortable with that. You got to have the right psychological safety across the organization to feel like it's not a blame game. We're just trying to help. This is where we need to focus, and let's put the right measures in place.
I love that what you're saying about, red's okay, because I think that's a misnomer out there that, red is bad, right? We're not doing the right things. And really, red is an opportunity, right? Continuous improvement. What can we do to get better? And that's one of the tenets of process-based leadership that we talk about is, hey, red is where you can get better. It shows you where to focus your efforts and your energies.
Yeah, an all green scorecard, I start to think, I'm like, are we really, aspiring and pushing the organization in the right way? And, a little bit of red is okay. That's just a focus area. So yeah, it does take time, but it takes the right leadership, and it starts from leaders, right? Senior leaders to say, it's okay. This is just an area we're going to focus on and we're going to get better. But you need to provide that psychological safety.
That's a really good point about your comment of senior leaders, because it's a different hat in a startup environment where it's very entrepreneurial and we're trying to scale. And you're in that environment now versus like a BMS environment or a Genentech or a Roche environment. That's a legacy organization. As you've tried to pivot your leadership in a startup versus a legacy organization, what lessons have you learned from that? Yeah,
so I think the biggest lesson I've learned, it takes a little bit more time at a smaller company where you have, there is a notion that putting in processes, operations, or governance slows things down. Mm-hmm. And I had to educate people, actually help speed things up. And because many people, why are you putting more red tape? No, it's not red tape. This is just putting a process so you're systematic and you're not having to, If you have a standard agenda, then you're not having to think like, what am I going to do next week? Or what are we going to talk about? No, it's like, here's what we have, a cadence here.
Mm-hmm.
And we have opportunities to bring things up and make sure we're communicating things up and down. So I think, going back and saying what's in it for you and making sure that they see the value proposition, then it makes a difference. And take it one step at a time. I've seen leaders who come to small companies and throw out this 40 metric type of scorecard. And I mean, you're just doing data analysis paralysis. People are like, oh my God, this is all the work I'm doing. I'm like, no, let's take 4 or 5 measures first. Let's start it, get going, and then iterate, right? Mm-hmm. And that's how you build momentum around this.
Yeah, that's a great point because, and I think it's one that needs to be amplified for just a second in that, yeah, you're right. People sometimes when they hear the word process, they have an allergic reaction to it, right?
Yes.
Because in their mind, it feels inhibitive or restrictive or even punitive, for some folks. But I think what you said is super key here in that the process has got to keep pace with the content of conversation. And so the way we make sure it keeps pace with the content of conversation is that we iterate and we ask ourselves, is this process working today like we designed it? And have the conditions of the business change, so the process should change. I think people react negatively when they never see a process change and the organization moves beyond the application of it.
You got it. Because you just keep doing the same thing over again, and that's madness, right? So I think the key is being able to kind of change and adapt. And that's the beauty is in small companies, you can do that relatively quickly. That's the power, right? So if it's not working, let's change it. There's no problem with fixing it, and let's get it right.
You said something else, Snehal, I want to just pull a thread on. You used the word cadence, right?
Yes.
And so much of effective leadership, regardless of if you're in an organization of 50 or 50,000, right, is connecting with people around a good communication process. What's been your experiences with building that cadence? Or, Seth and I were at the Army the last 2 days in Arkansas, and we were talking about a battle rhythm.
Yep.
And so, that rhythm of communication, can you describe maybe a little bit of how you've done that in your organizations? Because I think that is so critical for all leaders to understand.
Yeah. You guys talk about rhythm and having that, I'm an operations individual through and through, and I think transparency and communication is critical to success. Mm-hmm. If we're able to equip the folks at all levels with the knowledge, then, we've done our jobs as leaders, because then we're helping to remove obstacles. They have the right information attached to be able to make the appropriate decision. So, I think up and down communication is critical, and you have to necessitate that. You got to build the process around it. You can't just have one-way communication. You've got to say, okay, tell me more. Like, how do we bring things up and be able to have that speak up culture? Again, it goes back to developing the tools to enable that.
Mm-hmm.
It could be you don't have to have such a widespread system or anything. It could be just, okay, here's how we're going to talk to one another. Stand up huddle every day. Here's how we understand what's going down at the different tiers. Just start with the quick huddle and a coordination discussion and understand what's the pulse of the organization. Mm-hmm. And then you start to see a rhythm, and you start, it's not just me bringing this. You start to see the other teams coalesce and say, oh, we can do this. And I love to see that when I see the different levels creating their own little communication cascades up and down. It's a beautiful thing.
Yeah, for sure.
It's so important that you have a systematic way to communicate, because if you look at, organizations, what's going to be probably one of the top issues employees are going to complain about, right? Lack of communication. No one told me, I didn't know. Yep. And so having that rhythm and cadence, and you touched on it, Snehal. It's like, this is how we're going to communicate. This is how we're going to operate. Setting the expectations of, this isn't in addition to your job. It's an enabler of your job. It's going to help you do it when we have this flow of communication, pass up, pass down, pass to share. Here's what you need to know the next 7 days. Here's what you need to know for today's work. That's just critical in making that happen.
You're right. And it starts, again, at the top. So our CEO, has a weekly huddle with the entire company, and it doesn't matter how big. He helps communicate what's top of mind, what's going on, both externally, internally. And then we follow that rhythm, right? So I think, what I've been able to do is we started to do certain dashboards every month, even at the CEO level and the C-suite level. Well, I could see my other partners kind of like scrambling at the last minute trying to figure out, okay, what's the data and how do I communicate this? And I'm like, nope, we're going to develop a process. And here's our process. Before it goes to that next level up, we're going to have our conversation and we're going to make sure we're all aligned with what's going up to the top and we have the right action plans. So people like you're very calm during these types of dashboard meetings and such. I'm like, yeah, because we developed a rhythm, a cadence, a process, right? So I'm not scrambling at the last minute. People know what their responsibilities and accountabilities are. They know what they need to do, and then that scales up, and then it comes down.
Yeah, that's fantastic. And, I think part of building that process is setting what we call ideal behaviors, right? Like, what do you expect of me? What do I expect of you? And really grounding ourselves. I mean, you mentioned a second ago about a speak up culture. And I think a speak up culture can only happen when we've got that psychological safety, and you get psychological safety through the setting of those ideal behaviors, right? So we're all grounded in how we show up, right?
Yes.
Have you had some experiences, Snehal, with your teams that you've sat down and I know I've facilitated some of these with you, right? Where you've asked the team, what do you expect of me? What do I expect of you? What's been the lesson in that for you?
Yeah, so many times in my career I've inherited leadership teams. So it's an opportunity, and every leadership team is different. And the one that I've had most recently, they were a quiet bunch. They're very analytical, research, just development. They don't have a lot of experience with operations, so and they didn't have a leader who is willing to listen and bring people in and be inclusive. So they were used to a previous leader who was very just top down, one way of doing things. And I had to kind of help break that up a little bit and say, it's okay, it happens over time and it doesn't happen in a group setting. So it goes back to what Seth said. And it's really about every individual is different and has their own needs. So maybe it's in a one-on-one conversation, like help me understand like how I can help you. What could I be doing differently? There are many times that I learned that I thought I was doing the right thing. I'm like, asking, an individual like, here, speak up. And they're like, please don't ever do that to me. Right. And they don't I'd rather have a different conversation with you one-on-one, and then we can have that. So, I learned, right? And I think the first thing as leaders you need to do is ask for feedback and ask for like, what could I do differently? What do you appreciate that I'm doing? Where do you feel like I could change? And if you ask and you're willing to listen and make those changes, it'll go a long way.
That is so powerful because that requires humility though, right? So I think sometimes we ask a question hoping that we get the answer we're wanting to hear. Yes. And sometimes we don't get that answer. I mean, I know in my own company, I've asked that question and sometimes the answer you get hurts my feelings. But if you kind of can step back from that and say, okay, how do I take this and look at it not as a critique, but as a way to align so that from this day forward, that feeling or that frustration or that conflict is mitigated because now we've talked about it, right?
Yes.
And I know you're a big proponent of one-on-ones, like with your teams, and really sitting down with those folks. And I know we've talked about this at length over the years, right? About the power of that one-on-one and understanding that. Is your sequence still like once a month or once a week, or what sequence are you in now with your team on one-on-ones?
Oh, I spend a good portion of my day with one-on-ones and even going deeper in the organization because it's an opportunity where I get a pulse check of what's going on and how I can help them. Like, what are the challenges they're facing? Because it helps me then know like, okay, this ain't working. We need to change this. So I go deep into the organization and just reach out, and I make it very clear that, look, this is very, this is not something that has to be mandated or you have to come and report to me. No, it's really just an opportunity to discuss, check in. How are things? How can I help you? And some people come with agendas. Some people just want to talk and get a pulse of what's going on. And I enjoy them thoroughly. It gets me an understanding of what's going on and also learning more about the organization.
Mm-hmm.
What would be your piece of advice to a young leader? I mean, as you reflect back on your career and someone's frontline supervisor, they're just getting into leadership roles. I mean, you shared some great things. The one-on-ones are key and the need to communicate. But what would you share with someone?
Yeah, and I have this conversation with many across, and my thing is when they ask me something similar, and if I were to go back, get uncomfortable. It's okay. Take that leap because your growth is going to be exponential. Many people are just want to I just want to do this, but you'll see opportunities and don't be afraid to take those opportunities. And, you have it within you where you will succeed and you'll learn and you'll grow. Many times in my career, people help me get into those different roles. And I was like, whoa, I don't know if I can do this. But then I said, all right, I know I've got the right abilities and skill sets to learn, and I'm going to figure this out. And I kid you not, that's where I had the most unprecedented growth. And it gave me confidence that I could do this, So what I would say to folks is go explore. Don't be afraid. Get a little uncomfortable because that's where the growth is really at.
Yeah, I've got a sign my wife gave me that says good things never come from comfort zones.
Yes. That's right. It's a great reminder.
Yeah, it just serves as a reminder that, the other thing I think that, good leaders do is it's okay to say, I don't know, or I was wrong, or I'm sorry, that humility that you had talked about that, I've seen it in some of the organizations we work with where leaders they're not willing to humble themselves and say, you know what, I was wrong. That was a bad decision, but let's learn from it.
Yeah, I would agree. That accountability goes a long way, and that humility and sharing that with your team will help them see that in you, and they'll be like, okay, he's just a normal person like all of us. So,
yeah.
Mm-hmm. You mentioned a word there, and I think it's something we should talk about, right? We've talked a lot about humility and empathy and how we show up, but there's another part that's about accountability and execution. And so how have you balanced being this inclusive, collaborative, consensus building leader with the need to, at the end of the day, still execute on our mission and our vision and our metrics? Because sometimes that's a hard bridge for leaders to traverse.
Yeah, I think, it is hard, but I think accountability starts with yourself, right? And saying, okay, this is important. And when we develop these scorecards or goals or these dashboards, we do put the accountable person there and say, look, you're responsible for end to end, and I'm here to help coach you, right? So you have to put the right measures in place, but also it's okay if, it's a stretch goal or whatever. You're helping to coach that individual. People want to take the accountability, but then yet we don't give them the tools to do it. So I'll give you an example. Here at Sana, we've really focused on what we call the DRIC model, which is the decision-making models. There's a variety of different decision-making models, but those processes, that model really helps because it identifies the decision maker, it identifies who you need to get input on, and it's very clear that ultimately this individual is making the decision.
Mm-hmm. No, I think that's really good. And what was that again? Just so our listeners can maybe they can look that up, that model.
Yeah, there's DRIC model. That's what they call it, DRIC. There's also, there's the Learn model. There's a variety of different tools, but it's a framework to provide people an understanding. There's a STAR model as well, situation, task, alternatives, recommendation. It's
Mm-hmm.
really any model, but using a model and a process that will enable you to come to the appropriate decision. But it'll also outline who is the decision maker and what key
Yeah.
input do you need to make.
You mentioned a comment about coaching, and we always want to talk about the wins when we coach. But have you ever found yourself in a situation where you're trying to coach, but it just wasn't working, right?
Yeah. Yeah, it's happened. And you feel, it's really, I'm a people leader, and
Mm-hmm.
I love, to be able to put people in positions of success and really help them. But there are times when I've done everything I can, but the individual is it's just not resonating or connecting. And there have been times where I've learned that I've tried too hard, and but it works both ways. And the business, along with the people around on that leadership team, saw that I wasn't dealing with the problem,
Mm-hmm.
right? And I kept trying and trying. And what I've learned is that we have to give people an opportunity, but after giving that, if there's not a reciprocating acceptance or trying to change, the willingness to change, then you just got to cut bait and say, look, it's not working for both the organization, for us. I think the best thing for you to do is move on. And I think there have been times where I felt like a failure at first, like, okay, what am I not doing? But it's really also on the individual itself.
Mm-hmm. Yeah, I think sometimes those leaders who have that amplified empathy, that's the balance we walk, right? Of giving so many chances because we want so much for people to succeed and be the best version of themselves. But it's also that balance of, okay, we've tried, right? And they're not picking up the ball and running with it. So now we have to have a different conversation. And so I can absolutely appreciate that.
Yeah. Because the rest of the organization is looking for you to make that
Yeah.
call.
Yeah.
And yeah.
I want to kind of shift gears here, Snehal, and I know you've worked for some really great companies that have produced some phenomenal treatments and therapies to extend life for people. Has there been a moment, maybe you met a patient or something, an inflection point that validated your decision of going into the life sciences? Is there one or two that you can touch upon that you remember?
Absolutely. So the one that's near and dear to me, another key inflection point earlier on in my career, is my father-in-law had been dealing with non-Hodgkin's lymphoma for years, and he went through 2 rounds of traditional chemotherapy. And then I married my wife in 2000. In 2002, we learned that his non-Hodgkin's had come out of remission.
Mm-hmm.
And he told me I can't do another round of traditional chemotherapy. So at that point in time, I was at Genentech, and Genentech had come out with this new monoclonal antibody for non-Hodgkin's lymphoma called Rituxan.
Mm-hmm.
And this is I didn't know. I know I was making Rituxan, like, doing some cell culture and such, but I didn't know what Rituxan did, the science behind it, or talk to doctors. Like, you read this stuff on the internet about all the adverse events and such, and it scared me. So I reached out to my supervisor, who went all the way up to that. It was probably me at the time, and the chief medical officer. And this is what makes Genentech incredible is the chief medical officer, along with the head of tech ops, reached out to me, and I was just a technician, right? And they said, Snehal, we learned that your father-in-law is a non-Hodgkin's lymphoma. We have doctors here who you can talk to, and your father-in-law can talk to about Rituxan.
Oh my goodness.
And they connected me to the best doctors. I was there for his first treatment, and it extended his life by 10 years. He got to see both his grandkids on my side. He got to see his daughter, his second daughter and son get married. And he was grateful every day for that, for me, and I was just, that's what I was so committed to. And that really, you do make, you do provide hope, and you're able to change people's lives in the field that we're in. And ever since then, we talked to numerous patients across, and there's no better feeling than knowing you go home every day that you're providing hope, and that's what keeps me going. Just the ability to do that every day. That's why I'm so close to the folks on the manufacturing or bench, is because that's where the work is. That's where our jobs as leaders is to do everything we can to make them successful, because that's where it all boils down to.
You know what? I don't know that we could close a podcast with a more profound kind of story there. And, Snehal, I've seen you from that frontline supervisor when we met 20 years ago, but you even went further than that, back to being a technician working off shifts at Genentech, all the way up to being, the chief technology officer at Sana. And, that doesn't just happen to anybody. That happens because you embrace the very things that you believe in. And, for someone to say that you get up every morning because you bring hope to people, it's something that I wish more people could have that feeling and be that tied to the mission of their enterprise. And so I just have to tell you just a sincere thanks from Seth and I, and for you spending this time with us on this podcast, because when you can bring hope to people, that's the way we got to end it right there.
Yes. Yes. No, Snehal, thank you so much. That was great. And you had some great takeaways for leaders today and future leaders on what they can do. So thank you for your time, and thank you for continuing to help in the mission of working on therapies to extend lives. Thank you, Snehal.
Well, no, thank you guys, Seth, Shane. Look, you guys had a big part in who I am today, and I will always forever be grateful for what you guys shared with me and gave me the right tools and education. So, a lot of me is a lot of you guys too. So thank you. And it was a pleasure to be here.
Thank you, Snehal. And listen, thanks to our audience for joining us again for the 10th podcast. We will continue these each week with more guests and more topics that we feel are relevant for each leader to move both themselves and their business forward. So thank you for joining us. And again, Snehal, thank you.